Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we're going to discuss Lyme disease. Glad to be with you this evening. I'm actually participating from Austin, Texas tonight, so you may notice a little bit of a different room setup here. So the Basingis and I made our way down here a few days ago, so we'll be here over the next week or so. Anyhow, it's good to be here with you tonight. For those of you that are coming back again, welcome back. I'm glad to see that there's a number of familiar names on my message board. And I said, I believe that means you're getting some benefit out of it. So I'm glad that you're here. For those of you that are new, welcome. It's good to see some new people here. There's a couple ways you can participate in these webinars. So first, you could listen to the questions that people ask. The reason I say listen is in the live version, I actually do read them out loud, but in the live version, you can actually see them on your screen. And the recorded version, though, you can only hear what I read. You don't get to see them on the screen. The other way you can participate is to write a question. And the way you do that is on the bottom right-hand side of your screen is a chat box. You could use that chat box to write a question to me. The only thing I ask is as you write the question, do not hit the enter key until the whole question is complete. If you try to use that enter key to create multiple paragraphs, it sends multiple questions my direction, and that gets to be a little bit complicated for me to answer, okay? Because it shows up as a separate question on my side, and that gets hard to piece together all the different parts of your question. As usual, I am creating a recording of tonight's webinar, and I'll try to have that out tomorrow morning, usually somewhere between 9 to 9:30 a.m. Seattle time. Given that I'm in Austin, where everything is a couple hours early, I'll probably have it out very early in the morning for you as well, too. So yeah, and then tomorrow, also in that email will be link that you can sign up for the next series of webinars that will begin in February, actually. So let's see, so this makes our third webinar in January. I will be off the next couple weeks, actually, and then we'll be doing 3 of those in February again. Okay, so I hope you'll take that opportunity to sign up for the webinar that begin in February. All right. So without any further ado, let's go ahead and get started here. So this first question is from Colleen. Hi, Colleen. Let's see. Hi, Dr. Ross. I've got 2 questions. Question number 1, I normally take Mariva curcumin 3 times a day after my initial Herx from starting phytostan, 1 phytostan per day. Then upped the Mariva to 2 pills 3 times a day before increasing the phytostan to 2 pills 1 time a day. Now that I've been taking the 2 phytostan pills daily for 2 weeks, can I go back to my usual 1 Mariva 3 times a day? If not, for how much longer should I stay at the 2 Marivas 3 times a day? Question 2, I've heard Lyme patients tend to have a more difficult time with oral surgery. Is this true? And is there anything we should be especially mindful of having cavitation surgery for removal of a dead jawbone? Thank you so much for sharing your wisdom and guidance. All right. So what Colleen is talking about is when you start killing yeast, or if you start killing Lyme, or if you start killing Bartonella, Babesia, any of these infections, you can trigger what's known as a Herxheimer reaction. And what a Herxheimer reaction is your immune system sees all these dead germ parts and reacts by making a bunch of inflammatory chemicals called cytokines. Keep in mind, though, that most of your Lyme symptoms and your too many yeast symptoms and your mold toxicity symptoms, most of those are actually excess cytokine symptoms, okay? So let's talk about cytokines real quick, and then I'll talk about the Mariva question. So when your white blood cells see an infection, or they see a toxin, or they see yeast in your intestines, they react by making a bunch of inflammatory chemicals called cytokines. Now, cytokines are good and bad. On the good side, cytokines help turn the immune system on to help create more white blood cells, bring the white blood cells to where the infection is, and they help the white blood cells work better. Okay, that's all good. But in situations like in yeast overgrowth and in chronic Lyme disease and in mold toxicity, your immune system sometimes doesn't do the job right, and it winds up responding by making more and more cytokines to try to get some control of the germs, and eventually it makes too many cytokines. And the symptoms of too many cytokines are brain fog, fatigue, muscle wasting, interference with how your hormonal systems work, achiness, body pain, hormonal disruption, etc. I mean, basically anything that we call a Lyme disease symptom, part of that or all of it is due to excess of cytokines. Same thing with mold toxicity, same thing with yeast overgrowth in the intestines, okay? Now, when you start killing germs, the immune system sees those dead germ parts and reacts by making even more cytokines, and we call that a Herx reaction. So a Herx reaction is actually a cytokine surge triggered by killing germs, basically, okay? And so what we want to do is put you on something that's going to help control those cytokines or lower them. And one way to do that is to use curcumin. Curcumin is a component of the Indian seasoning turmeric. Curcumin gets inside of your white blood cells and blocks the factory production line, if you will, of cytokine production, okay? It interferes with a number of the steps in cytokine production within your white blood cells. So when you are herxing, if you try to block that cytokine production with curcumin, that sometimes makes it easier to go through it. You get over the herx a little bit quicker, all right? So what I usually recommend is that a person takes 500 milligrams 3 times a day, but if the herxing gets worse, you can take up to 1,000 milligrams 3 times a day. The Mariva that Colleen is talking about here is curcumin. It's a liposomal version of curcumin. Liposomal means it's microscopically wrapped in fat to increase its absorption. Thorne, which was making Mariva 500, recently changed it so that they now call it curcumin phytosome. And it's the same stuff. It has Mariva in it, but they just changed the name to curcumin phytosome, okay? So anyhow, that's what I usually recommend doing. In terms of how long do you take the elevated dose? Well, when your symptoms start getting back to your baseline, you can decrease it back down. So yeah, I think at this point from what you've written here, you could go to the 1 pill 1 time a day there. And I don't think there would be any problem with that, okay? All right. And then in terms of your second question here, I'm not, so in terms of dental issues and Lyme disease, the relationship with dental issues and Lyme disease is that some people with Lyme that have had root canals or have had root canals or that have had, well, usually root canals actually. One of the things that can happen is under the root canal, you can develop these cavitations or pockets of infection, basically, okay? And those pockets can become a source where Lyme can live, other infections can live, and it triggers more cytokines, so it can keep you feeling poorly. So there are some people in Lyme that if they have dental issues, if you go to a biologic dentist that can do some x-rays to tell if you have cavitations, they may want to either remove the tooth over that cavitation, or they may want to do injection of ozone in there to kill the infections in those areas, okay? Those are the main issues that people with Lyme have that are dental. In terms of, do people with Lyme that have these issues have any more difficulty getting over them than other people? Not that I'm aware of. Do people with Lyme have more dental issues than other people? Not that I'm aware of. It's just that in certain situations, people with Lyme, if they develop cavitations, it becomes an ongoing source that makes it difficult to deal with the infection, or it becomes an ongoing source that triggers excess cytokines. Okay, all right. Thanks for your question, Colleen. Good luck to you. Hello, Gail. Let's see. Hi, Dr. Ross. I have not been vaccinated for COVID, and I also have not gotten COVID because I have been living like it's 2020. This is getting old. I know that the vaccine is supposed to help you from getting seriously ill, but I am very worried about having an adverse reaction to the vaccine. I have an autoimmune issues, active Lyme infection, and high cytokine levels. I am wondering what % of your patients have had an adverse reaction to the vaccine and what the reactions were, and if any didn't go away. 2, also, can you explain to me why, if the Delta variant is gone, would I need to get the 2 original ancestral strain vaccines before I can get the bivalent booster? Question. How is getting a vaccine from a variant that is no longer here important or helpful? All right. So, Gal, you're asking some important questions. What I can reflect with you is there was some research that was done by LymeDisease.org when we first started giving vaccines back in, I guess, a year, 2 years ago now. And they looked at the experience of people with Lyme compared to people that don't have Lyme, and in terms of whether there was different outcomes, more risk of getting adverse reactions, et cetera. And what their data showed is that people with Lyme have the same chance of having adverse outcomes as people without Lyme, okay? And I have to say that probably has been my experience as well, too. So there are people, unfortunately, that do get adverse outcomes with the vaccine. I think in my practice, I probably have had 2 or 3 people total that had some adverse reactions. One of those people developed pretty severe neuropathy after the vaccine. And over the course of the year, that neuropathy has slowly improved and is almost gone now. Okay. There was another person that developed a lot of joint pain and arthritic pains, and even had difficulty moving, I believe neurologic difficulty moving. And that's a person that I haven't seen now in a good 6 months or so, so that I can't tell you what the end outcome was for them, okay? But what I can reflect is, yeah, there's a risk. There's also a risk, though, of getting COVID and having consequences of that, which could include death, chronic long COVID, which would be devastating to get on top of having Lyme. So it's a hard decision to make, right? Because there are risks to getting the vaccine, but there's risk in not getting vaccinated as well, too. But the one thing I would let you know is that having Lyme in and of itself is not an adverse risk of bad outcome in the COVID vaccine. That's what my experience has been, okay? All right. In terms of what the recommendation is right now, if you haven't had COVID vaccine, as to whether you have to get the original Delta variant vaccine, or can you go right to the bivalent vaccine? I'll be honest, I don't know what that recommendation is. I haven't had to face that issue, so I can't respond to that part of your question. To me, it would make more sense actually to go for the bivalent vaccine, but I don't know the ins and outs of that to answer your question on that one. And then anyhow, that I'd have to leave it at that. Okay. All right. Good luck to you, Gail. I know it's a hard decision, but you're weighing out risk and benefits, basically. My sense is that you have greater risk, even still, of bad complications from getting COVID that outweigh the risk of complications from the vaccine. But if you happen to be one of those people that does get a bad consequence of the vaccine, you're gonna that would not be good. But also, if you're one of the people that gets COVID, even still, and has a bad outcome from that, including death, that's not good either. All right, so it's a hard decision to make. I would suggest that you actually discuss it with your physician, who knows the ins and outs of your healthcare more than I do. I think that'd be a better way for you to go. Okay, all right. Good luck to you, Gail. Hello, S. Good evening, Doc. Which of the tick-borne infections creates intermittent blurry vision, and what can be done to improve it? Thank you. Both. So intermittent blurry vision, my experience has been that it's probably part of Bartonella. It can also be part of Lyme. Either one of those can have neurologic involvement of the muscles that make your lens hold form and therefore focus. Both of those, and so they can infect the optic nerve as well too. So both of the Lyme and Bartonella have the potential of doing something like that. Okay. Thanks for the question. Hello, David. Let's see. Which infection leaves pitted edema indentations running against the skin fold again? I've seen Bartonella cat scratch red streaks, but these are more indentations, which like the indentations that band on a sock would leave around the ankle. Thanks. Okay, so regarding comments, so I've talked before about Bartonella as leaving something can give you a rash that looks like scratch marks or stretch marks. And in Bartonella, that kind of a rash, the main way we know it's a Bartonella rash as opposed to stretch marks you might get from increased weight or natural stretch marks that occur in some people in certain areas of the body is that Bartonella stretch mark rash tends to run perpendicular at 90 degrees to the normal skin lines. Okay, that was the comment I made before. So everyone, if you weren't on that last one of the webinar, I discussed it. The way you could figure out, so your skin has a natural way that it folds. Okay, so let's see here. Yeah. Okay, so here, to find which direction your skin folds are, you just take and you squeeze. And if you notice, as I'm squeezing here, those lines form pretty easily. So the skin line here runs in that direction, okay? Versus if I try to squeeze the other way, you'll notice, oh, yeah, it actually, do that again here. Yeah, I'll do it on the back of my hand. So here, the skin lines go this way. Now, granted, I can get them to go, but they're a little bit harder to get the easy fold going that opposite direction, okay? So you could squeeze various areas in your body and see which is easier to make the skin folds occur. That's the natural direction that the skin lines run, okay? All right, now, what you're asking about is if your tissues below the skin start holding water, we call that edema. And that edema can be what's known as a pitting type edema. So if you were to push in the area where you have all that swelling in the tissues below the skin, you can leave indentation. You can leave a fingerprint in there if you want to, or a thumbprint in there if you want to. And socks, because of the pressure they put around the bands, is pressure pushing on that liquid. So, but there's not a universal way that edema forms marks, if you will. The marks are going to form based on where the most pressure is from the clothing you have over that area that's got pressure on it. Okay, it has nothing to do with the skin folds. It has more to do where is the pressure being put on that spot that's pushing liquid away, leaving the indentation in the skin. All right. Good luck to you, Dave. Hello, Lynn. Hi, Dr. Ross. Last week you said that my reactions to herbals like skullcap, berberine, olive leaf extract, and echinacea might not indicate Th1 dominance, as a practitioner suggested, but could be a Herx from killing Lyme germs. I want to clarify that I don't have Lyme any longer, more than 2 years post antibiotics without symptoms. But I do have positive results for each type of mold on the real-time lab tests. Could these herbals be causing a Herx reaction due to mold? Or what about Candida, which I have but am not sure? So it's a good question. I understand. We talked about this last week. You know, any of the herbal antibiotics have, and including olive leaf extract, berberine, they actually have the ability to kill yeast too. I would not, an olive leaf what I tend to think of as more something that's going to kill viruses, but it can kill yeast. Berberine can kill yeast. Berberine can kill bacterial imbalance in your intestines. We use it to create better balance of dysbiotic or imbalanced bacteria in the intestine, so you can get some Herxheimer from that. The skull cap, I'm not familiar enough with what other things it can kill, but most of these herbal antibiotics or herbal antimicrobials that we have are broad. They can kill viruses, they can kill bacteria, they can kill yeast as well too. So I still stand by probably that's the most likely thing you were getting is something as a killing reaction or a Herx reaction as part of that. Okay? All right. Thanks for that question, Lynn. Good luck to you. Hello, Karen. Let's see. How do you treat systemic fungal infections herbally and with prescription medications? All right. So I want to clarify one thing about what you mean by systemic and what I mean by systemic, okay? So generally 99.999% of the time when someone has systemic effects of a fungal infection, it is not that the yeast or the fungus is living throughout the body, all right? People that get yeast and fungus that live throughout the body everywhere have severe immune suppression, like in HIV and AIDS, for instance, not of the kind of immune suppression that people with Lyme have, all right? But when you do have yeast overgrowth in the intestines, for instance, you can have systemic effects, and that is that the immune system will see the yeast in the intestines and will react by releasing cytokines, all right? And those cytokines have effects throughout the whole body. So cytokines give you brain fog, make your body hurt, give you fatigue, et cetera, okay? Those are excess cytokine symptoms. So, and that could be true with various fungal infections. So when we talk about fungal infections, we're talking about people that have mold toxicity occasionally, rarely, or a small percentage, I should say, develop colonization, where the mold spores from the moldy environment they were living in, well, sometimes the mold spores will start to inhabit the nasal passages and inhabit the intestines, and that could trigger some cytokines giving you systemic effects, okay? Keep in mind about mold toxicity, the major problem people have with mold toxicity is not from getting mold spores living in their sinuses or their intestines. The major problem they have is that about 75% of us, when we breathe mold toxins in, we cannot remove them. It has nothing to do with getting mold spores in us. It has everything to do with the toxins that get in us get trapped. And when those toxins are trapped in us, that triggers cytokine excess. And so that can look a lot like Lyme disease, for instance, too, okay? In terms of treating yeast systemically, or yeast effects throughout the body. Number one, you want to do something to lower cytokines. So usually I have people take curcumin phytosome, 500 milligrams 3 times a day. I might also have them add in some liposomal glutathione. Glutathione is a very strong antioxidant made in every one of our cells to help fix injury. It's made in large amounts within the intestines, where it's used actually to help with detox as well too. But it lowers oxidizing agents that tell white blood cells to make cytokines. And so you can add it to a curcumin phytosome to get added benefit of not only blocking cytokine production in white blood cells with the curcumin phytosome, but then from outside the white blood cells, you can block the message getting to the white blood cells that tells them to make cytokines. And that's lowering oxidizing agents that do that, and glutathione can do that, okay? So in terms of changing the systemic effects of having yeast or fungus in you, you want to lower cytokines first. That's the first thing you want to do. The curcumin phytosome would be 500 milligrams 3 times a day. The other thing in terms of the glutathione, I usually like using a product by Research Nutritionals, which is called Trifortify. It's a liposomal glutathione. The reason I like using liposomal glutathione is regular glutathione is just horribly absorbed. But you can use a liposomal glutathione, which has great absorption. The Research Nutritionals product, they've done a great job researching and showing that it gets good absorption. And so you can use the liposomal product to get good absorption, okay? All right, then And regarding yeast, in terms of what you can use to kill intestinal yeast, you can use combination herbal products. And the herbal options are going to work about 85% of the time, but they're going to take about 2 to 3 months. One such product is a product made by Integrated Therapeutics called Phytostan. There's another one made by Karuna called Capri Plus. The herbs in Phytostan are caprylic acid, powder co, rosemary oil, I believe thyme oil is in there, and some indolicic acid. In the Capri Plus, the main ingredient is a caprylic acid, some garlic, and some oregano oil is in that one too. Those products I usually like using 2 pills twice a day. They're going to take a little longer than your prescription options, okay? And then in terms of prescription options to get rid of yeast overgrowth in the intestines or even in the vagina or even in your mouth would be, I like using, my starting combination is I like using is something called fluconazole, also known as diflucan, as a 200 milligram pill, 1 pill a day. I combine that with nystatin. It's a 500,000 international unit pill, 2 pills twice a day. The reason I use nystatin is yeast have the ability to learn resistance to diflucan or any of the members of that family. Like diflucan is called fluconazole. Another member is called itraconazole. There's a ketoconazole. All of these azoles, the yeast have an ability to learn resistance, and their chances of that happening go down if you combine it with nystatin. Now, nystatin stays in the intestines. It does not go systemic at all. It just stays right there, basically, okay? If you use an azole with nystatin, that kind of combination, so fluconazole with nystatin, usually you're talking 1 month of treatment, and it works effectively about 90% of the time. Occasionally, I have to go a second month with some of my patients as well, too. Okay, all right. In terms of if you are talking mold spore colonization of your nose passage or your intestines, those take a little bit longer. And generally, I usually like using, for the mold spore colonizations, I like using itraconazole, which is in the same family as the fluconazole. I treat for maybe around 4 months, and that's a 100 milligram pill, 2 pills 1 time a day. And then I like using nasal antifungal nose sprays up in the sinus passages to get at the colonized spores up here. And I usually like using either an amphotericin nose spray that has to be compounded by a compounding pharmacy, or I like using a nystatin nose spray. And you can even get itraconazole nose spray made as well too. Okay. All right. I'll show you some resources you can look at here real quick. And thanks for that question. Good luck to you. So let's see. I don't know why. For some reason, looks like it's not going to share here. Hold on just a minute. No. Yeah, it's not working. At least I don't think it's working. Anyhow, sorry about that. It does not look like my screen share is going to work again tonight, and I don't know why. So whenever I use this laptop computer, for some reason, it does not work. Let's see here. I'll try that again. Nope, just not going to do it. So I apologize for that. So what I wanted to show you was on my Treat Lyme site, so treatlyme.net, which is Treat Lyme by Marty Ross MD. If you go to the website, you're going to see on the top navigation menu is something called Lyme Guide, okay? Just hover over that. That's going to drop down a huge menu, basically. Ooh, lighting just changed here all of a sudden. Anyhow, that's going to drop down a big menu, basically, okay? And a mega menu. One of the options you're going to see is a choice that says yeast. Click on that, and that's going to bring you to a page that gives you options in terms of how to diagnose yeast, but also an article about called Kills and Prevents Yeast, a brief guide, which is the information I have about how do you treat yeast, okay? All right. In terms of mold toxicity, you would need to, you could use the search bar up at the top of the website, and you just write in mold toxicity, And you'll find the article that I've written there where I describe the various things you could use to treat, to bind up the mold toxins, but also to kill the mold spores as well too. Okay. All right. Good luck to you. Very interesting. I guess I just lost my lights in this room. But it changed. Anyhow, there's some background lights and then some video lights, and the video lights are still working, but the background lights just left. Anyhow, it looks like I think you can still see me at least, so that's good. Hello, Flavia. Let's see. Hi, Dr. Ross. Thank you for your time. You're welcome. For Bart and Babesia, instead of switching rifabutin to add methylene blue, could we just hold on a minute. Instead of switching rifabutin to add methylene blue, could we just add methylene blue? Current protocol is doxy, azithromycin, rifabutin, and malurone. Possibly add methylene blue to help with mental clarity. Thank you. So last week, anyway, Flavia may be responding to is I had a question. And I'm not sure if it was from you, Flavia, or somebody else, but there was a question about what to do for brain fog with Bartonella. And as a person that already was on a treatment that involved this, they were on azithromycin, as I remember, rifabutin, and malurone. In this protocol here, doxy, azithromycin, and rifabutin all target Bartonella. And the person had been using this, and the brain fog was not budging. And in my webinar, the webinar last week, I described that I am seeing benefit from actually adding, stopping the rifabutin in situations like this, and either adding methylene blue, which seems to be helpful for brain fog, and also the azoles like diflucan, a yeast medicine. But it also has got some good data showing that it can help treat growing and persister Bartonella. And so I was saying, especially if brain fog is not lifting, you may want to get rid of the rifabutin and put in a methylene blue or put in a fluconazole. Right now, to answer your question, could you add methylene blue on top of this? Yeah, but you're really talking a lot of toxicity here. I mean, you've got doxy, which is a toxin, azithromycin's a toxin, rifabutin's a toxin, malurone's a toxin, and then you want to put methylene blue in, another toxin. I tend in my treatments, I tend to like to go, although I come up with complex regimens sometimes, as much as I can, I try to limit the number of antibiotics I have somebody on. If something else is already doing the job or covers us a certain way, then I tend not to try to do 2 and 3 things that are all doing the same thing. But could you? Yeah, you could. But you do run the risk of more interactions and possibly toxic effects of being on all these things too. Okay. Anyhow, thanks for the question, Flavia. Hello, Carter. Let's see. I feel like my infections run up and down my spine and is highly variable. If I go to stretch, it will simply move into a different vertebrae with a lot of popping and cracking like a 90-year-old arthritic man. Is there an infection here that my immune system simply is not attacking anymore? And it's just eat me alive like termites. Okay. So Carter, I would need to spend some time asking you a bunch of questions about your overall symptoms, your overall health, to kind of give you a final answer on this. But I'll make one observation here, and that is one of the things that we see when people have wandering symptoms where they move around, think Lyme disease, think the Lyme infection, as opposed to Bartonella, as opposed to Babesia, as opposed to the other infections, okay? And who came up with that idea is a physician named Richard Horowitz. Many of you may be familiar with Dr. Horowitz. He wrote a book, Why Can't I Get Better? In that book, he perfected a questionnaire that's designed to help people figure out if they might have Lyme disease, okay? And specifically in that questionnaire, it asked a number of questions, but one of the questions he asked is, do you have wandering neurologic symptoms? Another one is, do you have wandering joint pain? And what he's been able to show through some subsequent research is that when you have wandering nerve pain or wandering joint pains, that is as good as a Lyme test at showing that you have Lyme disease. Okay. So it can be pretty accurate at indicating, I should say, Lyme infection, I should say. Okay. All right. Good luck to you, Carter. Hello, Laura. Hello, Dr. Ross. Can you please explain how a low or poorly functioning immune system from past mold exposure and Bartonella impacts the thyroid? Thank you. It's a good question. So I may not answer this directly for you, but what I would say is, so there is if an immune system is not functioning, it may have different ways it's not functioning. Okay. So one is it just may not be mobilizing to fight infections well. Okay. Or we call that Th1 dysfunction. Okay. There's another type of dysfunction of the immune system where something known as Th2 and Th17 parts of the immune system are overactive, which then suppresses your germ fighting abilities. They suppress Th1, which is the part of your immune system that attacks germs. Okay. So Th2 part of the immune system is made up of, well, that are known as your white blood cell B cells. They make antibodies. Antibodies are part of your defensive squad that constantly circulate to try to keep infections under control. Also in Th2 would be your mast cells. They're the allergy cells. And there's a number of cells also in Th2 that are part of what is known our autoimmune illness, where your immune system starts attacking you instead, or parts of you instead of the germs. Okay, that's all under Th2. Th17, it would be the cells that sit underneath your skin, underneath your mucous membranes, ready to catch an invader if it gets through. Okay. And what we tend to see is that in people with chronic Lyme, they have poor Th1, meaning their immune system has a hard time fighting germs, and an overactive Th2, Th17. That overactive Th2, Th17 leads to autoimmune illness, or is part of autoimmune illness. And autoimmune, you can get autoimmune thyroid disorders possibly triggered by Lyme. Okay, that would be the relationship. Okay, now there's a way to kind of go at this, especially if you have autoimmune thyroid illness, and that is I like to have people try something called low-dose naltrexone. And low-dose naltrexone is made from naltrexone. Naltrexone is manufactured at a high dose of 50 milligrams, and we use it for people with drug overdoses. It's useful for people with narcotic overdoses, okay? But at lower doses, at about 1.5 to 4.5 milligrams a day, it has an effect of regulating the immune system. In particular, it can lead to elevations of a type of cell called a T regulatory cell. All right. So you've got Th1 cells are the ones that fight infections. You've got Th2, Th17. They're the kind of defensive squad. Okay. And then you've got Tregs. Tregs are like the parent in the room. They're supposed to kind of keep balance between Th1 and Th2, Th17. And what you can do with low-dose naltrexone is it helps raise up the Treg cells so they can better keep regulate the balance between Th1 versus Th2, Th17. Okay, so those are some thoughts for you. Okay, if you want to read more about low-dose naltrexone, I do have a whole article on that at treatlyme.net. And the way you would do that is just literally go to my website, treatlyme.net, and in the search bar up at the top, write in LDN. You'll find my article where I describe how LDN works, how you dose it, how long you should use it. Generally, you want to give it about a 6-month try to see if it's going to make a difference. Okay. All right. So in my patients that have Hashimoto's thyroiditis or low thyroid as part of an autoimmune illness triggered by Lyme, I get good benefits trying the low-dose naltrexone. Okay. All right. Thanks for your question. Hello, Leslie. Let's see. Hi, Dr. Ross. Can Babesia air hunger wax and wane all through the day or disappear for weeks to come back? IGenex showed equivocal. Yes, I have seen it do that. Keep in mind, not all air hunger is Babesia, but it could do that. Okay. Also be aware that air hunger, that feeling I can't get enough air from time to time, can be part of Bartonella as well too. To figure out if you have Bartonella or Babesia, you can do the testing. The best Babesia test these days is the new Immunoblot for Babesia from IGenex. The best Bartonella test, as far as I'm concerned these days, at finding if you have Bartonella is the Immunoblot that IGenex runs for Bartonella as well too. Okay. Also, you could look and see if you have enough symptoms indicating Bartonella or Babesia, because testing is not perfect. So if you want to see what the symptoms of Bartonella are or the symptoms of Babesia are, when you go to my Lyme information site, treatlyme.net, when you click on the Lyme guide, it has this huge mega menu that drops down. Over in one of the right-hand columns is something called How to Diagnose. Click on that and you'll find the articles about how to diagnose Babesia and how to diagnose Bartonella. In there, I list out the key symptoms that you might have if you have Bartonella. Okay. So for Bartonella, the big symptoms are air hunger can be one. Having a lot of nighttime sweating can be another. Having periods where your blood pressure just drops out of nowhere for no reason at all. Large anxiety attacks that come out of nowhere. And then also having these red petechiae or red marks on your skin can sometimes be part of or hemangiomas, red hemangiomas can sometimes be part of Babesia as well too, okay? Bartonella symptoms, Bartonella people tend to have a lot of pain on the soles of the feet. That gets better as you start walking first thing in the morning. Bartonella gives a lot of neurologic dysfunction, so people can have tremors, they can have internal feelings of buzzing or vibrating, they can have loss of nerve function, they can have neuropathies. Bartonella also gives a lot of psych issues as well too. So people often will have ongoing anxiety, not panic attack anxiety, but ongoing anxiety, or they might have depression. Okay. But then another symptom people with Bartonella can sometimes get is air hunger. That can be part of Bartonella as well too. Okay. All right. Good luck to you, Leslie. Hello, Joe. Hi, Dr. Ross. I've heard some people using diatomaceous earth to treat their Lyme disease. I would be curious to hear what your thoughts are on diatomaceous earth. Is this a useful substance to help treat Lyme disease? Do you ever recommend it to your patients, or have you heard of your patients using it? Thanks for all of these fantastic webinars. You're welcome. I haven't run into anyone using that in my practice. Now, usually I hear of all this stuff because people try things in this illness, but that is one I haven't seen happen actually. As to how it would work, I don't know. I haven't seen any data suggesting that it works. I haven't seen any publications on that. And generally, if there's something out there, I have found it. I'm usually pretty good at finding the latest articles on things, but I haven't seen anything on that one. Okay. All right. Thanks for the question, Joe. Good luck to you. Hello, Regan. Let's see. Have you ever seen a foot become purplish or bluish and rashes on the shin? I have not seen shin rashes as part of this. I have seen bluish, purplish changes in the feet and in the hands. And sometimes those changes can be part of something called Raynaud's phenomenon or Raynaud's syndrome. What happens in Raynaud's is infections or mold toxicity or autoimmune illness can trigger spasm of the small blood vessels in your digits and in your feet, limiting blood flow to those areas. And you can get either white colored changes or purplish reddish color changes that sometimes happen. In a very severe state, you can actually block blood flow, and people have lost digits from bad Raynaud's phenomenon before. In terms of how I manage Raynaud's, I usually like to try to get the infections or mold toxicity under control. To help improve blood flow to those areas, herbally, I might try ginkgo biloba. Ginkgo can help your blood flow more easily into these real narrowed areas. People try like about 80 milligrams 3 times a day. I might try some lumbar kinase. Lumbar kinase can help decrease the thickening of the blood by breaking down fibrin, a blood clotting protein that sometimes is made in excess when people have chronic infections, and that extra blood clotting protein in the blood makes it more sluggish, so it doesn't flow as easily. So my herbal approach to Raynaud's is ginkgo biloba, 80 milligrams 3 times a day, with lumbar kinase 16 milligrams once or twice a day. If that's not effective enough, then I might look at doing some prescription management of the Raynaud's, and that would be to use a group of blood pressure medicines called calcium channel blockers. They sometimes can help block that spasming from happening. Those would be things like Norvasc, Procardia, nifedipine. Those would be things you might try. And the nitroglycerins that we sometimes use for people with heart disease can sometimes help with the Raynaud's phenomenon in the digits as well too. Okay. All right. Thanks for that question. Good luck. Regan, you might want to talk to your doctor so they can actually look at this to be sure what it is. But what I was saying is it might be the Raynaud's. Okay. Good luck to you. Hello, Jen. Hello, Dr. Ross. Thank you for your commitment to this community. You're welcome. What advice do you give to your patients in regards to diet? Also, what do you know about Lyme? I think you said lasers, Lyme lasers. Thank you. So I haven't seen, I know some of my patients try lasers. Supposedly they think it's going to kill the Lyme. To be honest, I don't see good outcomes from that. Beyond that, I can't tell you what the theory is about how they're supposed to work. I will tell you there's not data that shows that it does work, okay? And also I'd reflect that in my patient, excuse me, in my patients that have tried it, that I don't tend to see a lot of benefit from it as well too. In terms of diet, there's a few ways that we can go. So one, if you look at my treatment protocol, the Ross Lyme Support Protocol, if you go to my website and you look under the Lyme disease guideline, Lyme disease protocol up at the top, click on that, that'll show my whole protocol. There is a section in there where I talk about diet. And there's basically 2 diets that I have there, but there's a third one you could try too. So one of the diets is for people that have a lot of difficulty where they're reacting to all kinds of food. What I suggest they try is something called an elimination diet, where you remove a number of things that we think people can be allergic to and reactive to, and you pull them out of the diet. You pull them out for about 3 weeks, and then you slowly start introducing things back in again to see which ones are they really reacting against, okay? So that's one option. My preferred option, especially early in a Lyme treatment, is to have somebody try a plant forward paleo diet. Now, notice I said plant forward. I didn't say it's all plant. But if you have paleo diets tend to be very supportive of the cell energy factories called mitochondria. Okay, and especially early in infections, people have such low energy that I'd like to try to get them on a diet that's going to help support their energy factories to work better. The other thing I like about using a paleo diet is that it is low in beans, legumes, and grains, and therefore it decreases your chances of getting yeast overgrowth from being on the antibiotics. Also, in a plant-forward paleo-type diet, you get a lot of good nutrition and fiber from your plants that you're eating, and also from the limited fruit that you have as part of that too, okay? All right. The other type of diet that sometimes can be useful, and I might move people more towards after the initial period, would be to look at a Mediterranean style diet, okay? So the reason I like Mediterranean style diet is they're anti-inflammatory. The plant-based paleo type diet that I recommend is also anti-inflammatory. If you go to my treatment protocol, you're going to see there's a link two resources that you can figure out how to do the elimination diet. And I also link you to my main diet about how to do a paleo type diet. And it has resources about how do you institute that as well too as part of it. It's a diet that I got from the Institute for Functional Medicine that they allowed me to put it up on my website. It's the background materials from them. Okay. All right. Thanks for that question, Jen. Hello, Brewster. Let's see. My hands get very cold and bright red on the tops. Have you seen this before? Brewster, not usually just on the tops. I've seen it, as I indicated earlier, there's this phenomenon called Raynaud's, but Raynaud's is going to be both sides of the hand. It's not going to be one-sided. The one thing you might consider that people can get a lot of redness on the backside of their hands is if they're on tetracyclines. As part of treating their Lyme infection. So doxycycline, minocycline, and tetracycline all lead to easy sunburning. And so sometimes you can get redness on the backside hand. Sometimes you get blisters from it as well too. But that would be the only thing I can think of. Okay. All right. Good luck to you. Hello, Thomas. Let's see. I had heat intolerance, but that improved when I got yeast under control. However, I still have significant cold intolerance, and it's very specific, anything under 73 or 72 degrees, and I just get cold so easily. I've seen other people with this exact same symptom. Do you know what could be a regular doctor, of course, is going to say it's psychosomatic? But I've met too many people and it's too specific to a degree not to be something quite particular. Okay. So when I think of people that have cold intolerance, I'm thinking of low thyroid. The trouble is the way that your conventional doctor is going to look for it, they may miss it because they're not aware of all aspects of low thyroid and chronic fatiguing illness and in chronic Lyme disease. Okay. So the way that your standard doctor is probably going to look at it is they measure a chemical. They'll do a blood test, and they're going to predominantly look at something called thyroid stimulating hormone, also known as TSH. Thyroid stimulating hormone is made by a part of your brain called the hypothalamus pituitary. It's made up there as the brain interprets whether there's enough thyroid. If the brain doesn't think there's enough thyroid, it starts yelling at your thyroid gland here to make more thyroid, and its messenger, its yelling messenger, is thyroid stimulating hormone. Okay. But the amount of TSH it makes is all dependent upon whether the brain is able to correctly interpret whether you have low thyroid or not. And maybe in chronic Lyme, it's not able to. All right. What is better, actually, is if you have a TSH, a T4 level, a T3 level, and something called reverse T3 measured. All right. So the thyroid gland makes 90% of what it makes is the thyroid called T4. And about 10% of what it makes is something called T3. The difference between those two thyroid hormones is, there's a couple of differences. One is iodine, right? So T4 has 4 pieces of iodine on it. T3 has 3 pieces of iodine on it, okay? But the other big difference, is that T4 is relatively inactive. And it gets absorbed into the cells. And inside the cells, it's converted through some enzyme reactions into T3. And it's T3 that drives the metabolic rate and the idle speed of your body, basically. Okay. And so one of the things that can happen in this disorder is that some people have a hard time converting T4 to T3. We call that peripheral hypothyroidism or peripheral thyroid resistance. And if that happens, instead of all that T4 being converted into T3, it gets converted into reverse T3. So I would have you check a reverse T3. And if the reverse T3 is very elevated, that means your tissues are having a hard time converting T4 to T3, and that's why you're running cold all the time. Okay. The treatment for not being able to get enough T3 is to, or elevated reverse T3 is to take T3 as your thyroid. So something called Cytomel is one way to do that. Okay. Now, conventional doctors don't like using T3. They like using something called levothyroxine, which is synthetic T4. Okay. All right. Now, let's say you get your studies back. Your TSH is normal. Your T4 and your T3 are normal. Your reverse T3 is normal, but you still have a lot of cold intolerance. But your T4 and your T3 are still, they're in a range where you could go up higher. They could go higher if you want to and still be normal. In those situations, if people have a lot of symptoms still of low thyroid, like cold intolerance, dry skin, sometimes rashes can be part of that, but mainly cold intolerance, dry skin, and muscle achiness, increased weight. They got a number of symptoms suggesting low thyroid, even if the thyroid blood testing is all normal. If I know from the blood testing that the T4, I could give more T4 and move them higher into normal range, and the T3, I can move them higher into normal range, I will still give thyroid in those situations too. Most conventional doctors will not. Many Lyme doctors will, okay? If I am going to try to impact both T4 and T3, I like using desiccated thyroid, something called armor thyroid. That's my preferred choice. Conventional doctors have been fed a bill of goods by the pharmaceutical company who tells them that that the dosing of desiccated thyroid is too unreliable from pill to pill, and so therefore they should use the synthetic version of just T4 by itself. All right. So what the issue is, it used to be that all thyroid medicines, way back many years ago, was ground up thyroid gland from beef and pork, or we call that desiccated thyroid. The issue is when you have like a 35 milligram pill of desiccated thyroid, the relative amount of active thyroid in there may vary from pill to pill. But keep in mind, the effect of the thyroid you take actually affects your thyroid levels and metabolism over a 3-week period of time. So if you have some variation from day to day, it doesn't matter because it's all balances out over that few week period of time. Okay. So I like using a lot of desiccated armor thyroid as opposed to doing levothyroxine or Synthroid in terms of when I have people that I think have subclinical low thyroid where all the testing is normal, but they still have a lot of symptoms. That's the situation I'm going to use desiccated, or also known as armor thyroid. If I've got somebody that has elevated reverse T3, that's the situation where I'm primarily going to use just T3 by itself. Okay. So if you want more information about this, take a look. There's a whole article I have on thyroid management and reverse T3s and all this testing I was just telling you about. You can look at that article. It's at treatlyme.net. I would show you, and again, for some reason on my laptop, my screen share does not work. But anyhow, take a look at treatlyme.net. In the search bar up at the top, just put thyroid. You're going to see this huge article that I wrote about thyroid management. Okay? All right. Good luck to you, Thomas. Hello, Mary. Let's see. Hi, Dr. Ross. Thank you for taking my question and your assistance. You're welcome. Let's see. I know you recommend fluconazole and clarithromycin together as a treatment for Bartonella. I like this combination, but I am a little nervous given the potential drug interaction. My Lyme physician prescribed me Rocephin, clarithromycin, and atovaquone. Another doctor prescribed me fluconazole for yeast. I'm hesitant to add clarithromycin to the treatment as my pharmacist has flagged an interaction between the two. My Lyme physician does not appear to be overly concerned about the interaction. Given your recommendation of this combination, what are your thoughts about QT prolongation arising from this interaction? Have you seen this issue in your practice? Okay, so what the issue is, there's a, as you know, when we measure how the heart is doing, we do an EKG, and there's an electrical pattern we see, and you've seen the thing go up and down and then goes up again. But there's a segment of that electrical transmission, which is called the QT interval. And there are certain drugs that can do some prolongation of that QT interval. And the problem is if you get a very prolonged QT interval, you can get an arrhythmia that can be harmful, okay? And so two of the drugs that can do that, fluconazole and clarithromycin, individually can. The concern is when you take two drugs that might do that together, you increase the chances of the QT interval prolongation, okay? Now, the way I approach this is if it's a younger person, let's say 40 or under, the chances of getting any harm from a QT interval prolongation is quite small. I generally will go ahead and do these drugs and not do anything more, okay? If I've got somebody that I am concerned about QT interval prolongation, as I put them on these drugs, I try to get a baseline EKG and see, to begin with, do they have QT interval prolongation on their own? If they do, I'm not going to use these two in combination. And then maybe a week or 2 weeks after they start the medications, I'll get another EKG and I'll see, have they prolonged their QT interval? Has it moved into a prolonged range? And if it has, then I'm going to stop it. Okay. So I do use these two together, but sometimes I have to be proactive and get EKGs to follow how it's going for a person, basically. Okay. All right. Thanks for your question. So I'm probably more like your Lyme doctor is in terms of my opinion on this one. Okay. All right. Good luck to you, Mary. Hello, Jake. Let's see. Hi, Dr. Ross. I have tested positive through IGenex for Lyme, Bartonella, and Babesia. I also have chronic nasal congestion that has been going on for several years. I frequently have a hard time breathing through my nose. Does Lyme or other co-infection cause nasal congestion? Do you have any advice on the best way to clear up the nasal congestion? Also, I noticed that you sell a product on your website called Oramex by Research Nutritionals. Is that product more for teeth and gum health, or would it be help with sinus issues? Thanks for doing these incredibly helpful webinars. You're welcome. So the Oramax is a probiotic for the mouth. Okay, so it would not help with the nasal symptoms that you're having. In terms of nasal symptoms, I do not see that Lyme, as in Borrelia infection, Bartonella, Babesia, Ehrlichia, Anaplasma have any regular problems that they cause with the sinuses. What does give a lot of sinus congestion is intestinal yeast. Yes, intestinal yeast can give you congestion up here. And what the relationship is your intestines have about 60% to 70% of the body's immune cells line the intestines, okay? And one of the type of cells that lines the intestines are mast cells. Mast cells are your allergy cells. So if you get too many yeast living in the intestines, they're going to trigger these mast cells to make more histamines, all right? And the histamines get into your bloodstream through the intestine. They get absorbed there. They float up into the nose, and they give you a lot of nasal congestion up here. They can even trigger asthma-like reactions as well, too, all right? So sometimes I've had patients where as part of what I like to do with my treatments, I always try to do some screening at the beginning of a treatment to see if somebody might have too many yeast living in their intestines at the beginning. And if they do, I'd like to clean the yeast out. And what I have found sometimes is all this nasal congestion that people have goes away, and people that have had years of having to use inhalers for their asthma, sometimes that all goes away as well too. Okay. All right. So that would be something for you to think about. If you want to see if you might have yeast, take a look at my, go to the treatlyme.net, the Treat Lyme by Marty Ross MD. On the treatment guide, you're going to see up there on the top, just click on that. It'll drop down my huge mega menu there. And one of the options you can do is click yeast. In there is an article about how to diagnose yeast. Okay. And I walk you through how do you diagnose it. One of the things you could do is a questionnaire that I have as part of it. Okay. All right. Good luck to you, Jake. Hello, Sandra. Let's see. Thanks for all your help, Dr. Ross. I have been on and off antibiotics, most recently doxycycline since September 22nd, very low dose, 50 milligrams to 100 milligrams a day. And I still don't feel well. Aches, visual floaters, headaches, bones hurt. I don't know if it's from doxy or herxing from Lyme and maybe Bartonella. My doctor is switching me to amoxicillin and fluconazole. Is this sufficient? And can these be taken together? Many thanks. I need relief as I'm not getting better. All right. So I mean, it could be sufficient. So if your infection is Lyme and it's not Bartonella, amoxicillin with fluconazole may be effective. The amoxicillin would work on treating what is known as the spirochete form of Lyme. So Lyme has different forms, appearances. Okay, so there's a form that looks like a corkscrew. We call that the spirochete. You've probably seen pictures on the internet of that one. Okay. Lyme also has a microscopic cyst form of the germ. And then finally, Lyme or we call that the cyst. And then the other form is something called an L form, where the germ moves inside of cells, sheds its covering, and it lives there as something called an L form. All right. Amoxicillin is good at treating the spirochete Lyme that's outside of cells. It works by preventing an injured cell covering from repairing itself, okay? So effectively, it kind of results in holes developing in the covering of the spirochete, and the spirochete eventually dies, all right? But, and then the fluconazole, being of a family called the azoles, has the ability to treat cyst Lyme and may get inside of cells to deal with L form, although I wouldn't call it the strongest L form treater, but maybe this would work on Lyme. For Bartonella, if that's what you have, fluconazole can help, but usually I like to have it used with another intracellular antibiotic. And again, amoxicillin is an extracellular antibiotic. So usually I like to combine my fluconazole with either clarithromycin, azithromycin, doxycycline, or minocycline. Okay. So anyhow, that's how I manage it. Okay. So those are things you might want to talk with your doctor about. Okay. Good luck to you. Hello, Stacy. Let's see. I'm a 26-year-old male who was diagnosed with PANDAS at 8 years old. I have had various levels of anxiety since then and have been experiencing depersonalization for the past 5 years, sometimes so intense it's unbearable. Dissociative episodes, sensitive light, visual disturbances, surroundings people, some seem surreal. This waxed and waned over the past 5 years. In May 2022, experienced an intense flare-up of these symptoms, in addition to headaches, intermittent muscle aches. I saw an eyelash doctor specialized in PANS Lyme disease, which we never considered previously. He immediately diagnosed me with Lyme disease. I have not had any typical episodes of Lyme disease. Symptoms such as bullseye rash, joint pain, fever, flu-like symptoms. My symptoms seem to be more neuropsychiatric in nature. He prescribed bicillin IM for 2 weeks, then rifampin, azithromycin, and nystatin. Symptoms did not improve and seemed to get worse with poor tolerance to antibiotics, headaches, and sleep disturbance. Stacy, let me see if I can find the next part of your question here. State, I'm not able to see the rest of your question. My only comment I would make is when somebody has a lot of neuropsychiatric concerns, we often think of Bartonella. And when you do try to make a diagnosis of Lyme and or Bartonella, it's not enough to have a blood test that says you have the illness. You also have to have a number of symptoms as suggested as well, too. And the number of symptoms you have of an illness increases the chances that a positive test is actually correct, okay? So the main thing I would try to do here that I would suggest is look at this with your doctor. Make sure that they did a test of some kind that shows that you might have Lyme or might have Bartonella. And also that you have enough symptoms to suggest you might have Lyme or Bartonella too, all right? The drug that he did, the rifampin azithromycin, is a combination that can treat Lyme and Bartonella. So he was treating both at that time. The other thing is, with PANS and PANDAS, it's possible to get another infection of strep that might have made things worse too. Strep can lead to the PANS and PANDAS. Azithromycin you are on here could have helped with the PANS PANDAS. The bicillin may have helped with strep as well too. So anyhow, those are thoughts. I don't know what your question is though, because I'm missing that part of it here. Good luck to you. Hello, Mickey. Let's see. How do you recommend dealing with reactivated EBV? I have had chronic Lyme since 16. The EBV became activated, elevated from the booster about 15 months ago. Had mild COVID last January. I have fibromyalgia, weight gain, fatigue, and brain fog. I have done acupuncture, a clean diet, celery juice, and the antivirals we recommend. MD told me to use B-propolis last month. I also get ceftriaxone with colloidal silver monthly. I've been on LDN 4.5 for over 4.5 milligrams for over 6 years. Would you recommend increasing the dose? How best to do? How about Myers cocktails? Would you recommend trying any antibiotics, ivermectin, other antivirals? Right. So I would take a step back. I'm not convinced you have reactivated EBV. And so let me explain myself. Okay. So if we were to pull a bunch of healthy people off the street and test them, we would find elevated EBV antibody levels in them. These are healthy people. All right. The thing about EBV is many of us can cohabitate with the germ and it doesn't cause us any problem. It is possible that this germ that our immune systems have kept under control can become reactivated, can start growing excessively. Okay. But an antibody level doesn't prove that's what's happened. All that an antibody level tells us is that the immune system is working hard to keep that germ under control. Maybe that's a good thing. Maybe it is keeping the germ under control. All right. So what I have come to do over time is I rely more on a test known as a nagalase level. Nagalase is an enzyme that is found in the covering of viruses. And if it is elevated, it would suggest an increased viral load, increased virus numbers, as opposed to just having an immune reaction. Okay. And so that's a test that I rely on. I get it from, there's a lab out in New Jersey called Health Diagnostics. If it comes back about 1.2 or higher, I have found benefit in treating for chronic virus infections. All right. Regarding ivermectin, everyone thinks it's the wonder drug suddenly that can treat every germ imaginable, but it doesn't. Ivermectin is an antiparasitic. That's it. And if we look at, I'm still, regarding its use in COVID, my review of the science says it's not that effective against COVID. I know other people have different opinions on that. There are no studies done showing that it is antiviral. There are no studies done, anti-EBV, I should say. There are no studies done showing it treats Lyme, Bartonella, et cetera, and yet a lot of my colleagues like to throw it at everything practically. The one reason people may feel better on ivermectin is that it is very good at lowering cytokines. Right? So it's an anti-inflammatory more than it is necessarily a good germ killer. Okay. Right. And in terms of other antivirals for EBV, the trouble is we don't have anti-EBV prescription antivirals. We just don't. Again, so I would go back and relook at, although your antibody levels are high, suggesting your immune system is working, maybe it's worked effectively and got your EBV under control. The only way to really know if EBV is out of control would be to measure the amount of active virus in you. We don't have a way of doing that directly other than to look at whether you have elevated levels of nagalase that can be elevated if you have active viruses in you. Okay, it's a way of looking at, do you have increased virus load in you? Okay, all right. Good luck to you. Hello, S. For the tick-borne vision issues, are there supplements or treatments to help improve vision or heal the optic nerve? So first of all, you want to make sure you're treating the right infections. So usually Lyme or Bartonella are going to be involved in vision. Secondly, you want to lower inflammation. So like using curcumin, phytosome, 500 milligrams 3 times a day. And then I like to do things that help support nerve repair. And so one of those is glutathione. Glutathione helps heal injured nerves by raising a good antioxidant levels that repair damage on the inside. I like using a Trifortify orange or watermelon product from Research Nutritionals, a teaspoon 1 time a day. Okay. Other things that might help with repair of the injured nerves would be to do what's known as phospholipid repair. So a nerve cell membrane is made up of a layer of phospholipids, and that can get injured, and you can repair that. I like using a product called ATP 360 by Research Nutritionals, 3 pills 1 time a day. It has the phospholipids in it that repair the covering. More recently, within the last 4 or 5 months, for my patients with nerve injury, that using glutathione and using ATP 360 is not necessarily helping, and getting inflammation under control and treating infections isn't working. More recently, I've started using a peptide called BPC-157. BPC-157 is a peptide that's made in our stomach linings. And among a number of things that it can do is it can repair tissue damage, including joint, tendon, muscles, and even neurologic injury. I've seen benefits using that. And so for that, it's a 500 milligram pill. You would do 1 pill twice a day. If you're going to use it to see if it's going to help, I usually advise people to do 2 to 3 months of it. Regarding the ATP 360, I usually try at least 2 months of it. If you're not getting benefit after 2 months, then I usually have people stop that as well too. Okay. And again, that's 3 pills 1 time a day on that. Okay. All right. Good luck to you. Hello, Meg. Let's see. What does Dr. Ross think of Dr. Horowitz's double-dose absent protocol at this newer version, quadruple dose dapton protocol? No, I haven't even heard he's doing a quadruple dose. All I can say is Dr. Horowitz, I think, is very well intended. The trouble with dapsone is it's a very hard drug. And when he originally was using it as a 100 milligram dose combined with cefuroxime and clarithromycin, azithromycin, doxycycline, or minocycline, one of those 4, and rifampin. So his original protocol would have called for dapsone up to 100 milligrams, rifampin 600 milligrams a day, and either doxy, mino, clarithromycin, or azithromycin, and cefuroxime. Okay. And in that study, he did publish a study, and it showed that there were about 56% of people had improvement. Great. But the trouble is 40% of people had to drop out because they couldn't tolerate the side effects. Okay. It's a hard drug. It's a really hard drug to take. Now, I know he's come up with this 200 milligram protocol, and he published a study on that. But what's remarkable about his 200 milligram protocol is he didn't publish anything about the dropout rate. He only published data about people that were able to continue it. So we have no idea of what happened, how many people had to drop out. I have no idea. And I don't know what he's done with his newer protocol. I haven't seen that one yet. It's a hard drug. And when you look at even the lower dose, the 100 milligram protocol, even though he was out promoting it pretty strongly, of those 56% of people that had improvements, the range of improvement was only 10 to 20% on average. Okay, it wasn't that great. It was not the saving medicine. That's not to say that some people haven't done great on it. I've had some people that have done great on it. In the 200 milligram protocol, there are some people he claims got cured, but I mean, there's anything we give that might cure people too. Okay. What I don't like that he's been doing is we're not getting the whole picture from him when he publishes stuff. It's as though he's kind of a big cheerleader for it instead of giving us all the data that we need to look at. Okay. And again, it got a side effects. So the side effects of dapsone could cause severe bone marrow depression. It can give you a lot of fatigue, muscle aches, just as a side effect. Okay, it can look like you're on Lyme, just as a side effect. So I don't know. I'll have to see what he's published to give us more data so we can tell. But even in using these protocols myself, I have not been that impressed, to be quite honest with you. Okay, all right. Thanks for the question, Meg. Everyone, if you want to read about dapsone, just in my at Treat Lyme by Marty Ross MD. Just write Dapsone in the search bar. You'll find the article on it. Okay. All right. Listen, everyone, I've got to step out about 10 minutes early here tonight. I've enjoyed being with you here. Take a look at your email tomorrow morning. You'll get a notice from me that the webinar is available to be viewed. I'll also have a sign up for the series of webinars that start in February for us as well, too. All right. It's been good to be here with you tonight. I look forward to being with you again and hanging with you in February. Good night, everyone.